training session. Today is going to be a relatively short webinar, as we only have 3 more clinical quality measures to cover today. As always, I've built in plenty of time for you to ask any questions you may have pertaining to these 3 quality measures we'll be covering, or any other questions regarding the clinical quality measures in ClinicsMD and reporting requirements for 2014. I'll jump straight into going to our clinical quality measures dashboard, which is available under the reports menu. And you'll see that I have the 3 reports in question already ran for today. The 3 we'll be covering are under 3 different healthcare domains. The first is Patient and Family Engagement Reports, CMS 157, PQRS number 143, for oncology patients, medical and radiation, pain intensity quantified. The next domain is Patient Safety Reports, CMS 132, PQRS number 192, patients with cataracts complications within 30 days following cataract surgery requiring additional surgical procedures. And the final one is under Population and Public Health Reports, CMS 147, which is also PQRS 110. It's under Preventative Care and Screening Measures, Influenza Immunization. This final one is a carryover from the original clinical quality measures that were first introduced in 2011, so you may be familiar with its requirements. All of the information being tracked in these quality measures can be found in the specification sheets we've provided under the Help menu in ClinicsMD in the Meaningful Use Stage 2 submenu. Here you'll find a direct link to our resources for the 2014 clinical quality measures. There is both a guide available, which is an overview of where each measure is documented and how it's tracked in ClinicsMD, and also the download for this clinical quality measure specification sheets provided by CMS for all 35 measures available in ClinicsMD. In these sheets, you will find detailed information, including the measure title, the CMS number, the clinical recommendations and clinical rationale behind the measure steward, such as the NCQA or American Medical Association, and the improvement notation, which indicates that either a higher percentage or lower percentage indicates better quality of care. This information will help you better utilize these clinical quality measures to improve patient outcomes in your practice. In addition, the very bottom of each and every specification sheet, you'll find a section called Data Criteria Elements. They have provided value sets for how each and every item is documented in both the denominator and the numerators for the measure. Example, CPT codes that define an office visit. They would be included in a specific value set. Specific diagnoses, such as a diagnosis of cancer, would be identified by a specific value set. And then you would see the full list of ICD codes and SNOMED codes that they use to identify cancer patients. I point this out because there is a tool available in ClinicsMD where you can see the full list of criteria being tracked in each measure. Again, I just mentioned active diagnosis of cancer being tracked by a specific value set ID. This value set ID contains all the codes that they use to identify cancer patients. So using this Search Value Sets tool, you will plug in the measure. In this case, it's CMS 132. And you can simply cut and paste that value set ID in this field and click Search. Or it would help if you put in the correct value set ID or copy and paste it correctly. There you go. And then over here, you'll now see for that value set ID identifying an active diagnosis of cancer, this is a full list of ICD-10, ICD-9, and then at the very bottom of the list, scrolling down, SNOMED codes that are used to identify cancer patients in this specification. So a patient having any one of these ICD codes or SNOMED CT codes in their chart would qualify them for the denominator in this measure, which is patients with an active diagnosis of cancer. Okay? I point that out because this tool is available for all of the measures available in ClinicsMD, so you can better use the information provided. So moving on, let's go ahead and cover the first measure, which is CMS 157, PQRS number 143 for your oncology patients, pain intensity quantified. This is the percentage of patients, regardless of age, with an active diagnosis of cancer currently receiving chemotherapy or radiation therapy, in which pain intensity is quantified. In other words, it is being tracked in their chart. To document this information in ClinicsMD, you will see that there's been a couple of new fields entered, or added rather, to your list of vital signs orders. These 4 pain severity scales can be used to record the pain severity level or quantifying the pain level for your patients that are going through chemotherapy or radiation therapy. Utilizing any one of these vital signs orders for the patient will suffice for this measure. In this case, the improvement notation is that a higher percentage indicates a better quality of care. Okay. Moving on is CMS number 132, PQRS number 192, specific for your patients with cataracts who have had complications within 30 days following cataract surgery that requires additional surgical procedures. Okay. This specifically tracks those patients that are 18 years and older. Major complications that are included in this measure are retained nuclear fragments, endophthalmitis, dislocated or wrong power IOL, retinal detachment, or wound dehiscence. In this case, the improvement notation is obviously a lower percentage indicates better quality of care. There are numerous denominator exclusions available for this measure, including acute and subacute reticulocytosis, central corneal ulcers, burns confined to the eye and adnexa, pseudoexfoliation syndrome, senile cataract, hypotony of eye, cataract secondary to ocular disorders, high hyperopia, injury to optic nerve and pathways, congenital cataracts, cysts of the iris, ciliary body, or interior chambers, glaucoma, mature or hypermature cataract, traumatic cataract, posterior polar cataract, pathologic myopia, open wounds of the eyeball, certain types of iridocyclitis, vascular disorders of iris and ciliary body, hereditary corneal dystrophies, and I could go on. I won't bore you with the details. All this information is available in the specification sheets. The surgeries that they're looking for, the additional surgical procedures, are listed as removal procedures, paracentesis procedures, excision of adhesions, aspiration and injection procedures, lens procedures, vitreous procedures, retinal repair procedures, scleral procedures, and revision procedures. So any one of those procedures, which are identified either by the procedure code, the CPT code entered in the patient's chart, or a specific SNOMED code that can be attached to a diagnosis for that patient, would insert that patient in the numerator for this measure. Again, that information would be entered in the Diagnosis tab of ClinicsMD. Both the diagnosis for your patients that have cataracts in addition to the procedures performed. The third and final measure is CMS 147, PQRS number 110, Preventative Care and Screening Influenza Immunizations. This tracks the percentage of patients aged 6 months and older seen with a visit in the flu season, which is defined as October 1st through March 31st, who received an influenza immunization or who reported previous receipt of an influenza immunization. The influenza immunization is documented in ClinicsMD in the Immunization tab. This is where the full data is charted. You could actually order it via the Order Entry tab or directly in here. Okay, that's how you would document influenza being given. To document if the patient received the vaccine from another source, in other words, you weren't the one administering the vaccine, mark the pre-existing checkbox, which sets the manufacturer to a known and indicates it's a historical vaccine. This report is specifically looking for a series of CVX codes, those immunization codes that are also used for immunization registry reporting, that are attached to your immunization orders in clinic setup. We covered this during the administrative setup webinar, but I'll show you one more time how to do that. In your orders list for your vaccines, select your specific vaccine and select the appropriate immunization code. Okay? And based on that, it will then provide a shortened return list of applicable manufacturers for that vaccine. So this report isn't just looking at the text for the order, it's looking for this series of CVX codes that the CDC has given for all immunization vaccines. Okay. So again, this is a very short session today. We only had 3 more clinical quality measures to cover. I'll go ahead and open the floor up now to questions. In the GoToWebinar meeting menu on the right-hand side of your screen, you'll see an option for questions where you can free text your questions in, and I'll go ahead and answer them for you one at a time. So go ahead and do that now. I'll give you a good 5 minutes or longer if I see more questions coming in, and I'll respond to them one at a time. Okay, we don't have that many questions, so I'll go ahead and jump into them. The first question and second, which is related, is regarding the CQMs specific for procedures such as the cataract surgery measure, CMS 132, how to record the information. The data sets that they have provided are procedure codes, CPT codes, so this would be prudent for the providers performing the procedures, since ophthalmologists can be included in meaningful use, or a specific SNOMED code, which you could choose to attach one time to a patient's encounter at the time you're diagnosing the patient in the Diagnosis tab. So you can do one of two methods. Again, either chart one of the specific procedure codes, otherwise known as a CPT code, in the Diagnosis tab, or attach a specific SNOMED one time to apply to this encounter only in the Diagnosis tab. That can be done here. Say, for example, 250. When you do a mapping one time to an encounter, you can do so here in the lower left-hand side of your screen. So you can do a one-time mapping for that patient for a diagnosis to indicate that they had a procedure performed one time. And that way it wouldn't be added into their list of procedure codes. Or conversely, what I've seen other clients end up doing is for their particular practice set up a zero charge for that specific code. Okay, doesn't look like we have any other questions today, so I'm going to go ahead and finish off the session. Thank you guys very much for attending. All of these webinars will be available under the ClinicsMD YouTube channel that you can find just by going to youtube.com and typing in your search ClinicsMD, or they will be available under the training link in ClinicsMD. You can get to them either way. Okay? So that note, have a great afternoon. Thank you for attending, and feel free to shoot me any questions you have after today's session. I can be reached at mary.brunson@clinicsmd.com, or you can send them directly to our support line at mdclientsupport@clinicsmd.com. Thanks, and have a great afternoon.